Hey Staten Island, this is HealthWish, a conversation about the state of healthcare in the fabulous 5th borough. Our aim is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone.
Hey Staten Island, we're back at the Alice Austen House Museum, celebrating Pride Month at the significant site in LGBTQ history and landmark of social reform photography. Our guests are Dr. Nicole Berwald, who is Staten Island University Hospital's Associate Medical Director and Chair of its Diversity and Inclusion Initiative, and Bisi Apanpa, Operations Manager of the hospital's Infectious Disease Program. In this episode, we touch upon the progressive nature of Northwell's Center for Equity of Care, its Katz Institute for Women's Health, and SIUH's work with the Pride Center of Staten Island to better serve members of the LGBTQ community. Give a listen.
I'll say a few things, and then I'll give a little teaser that I didn't know I would mention today. Okay. But when you say this about thinking about all of our team members, all of our patients, all of our community members from different backgrounds, we are very lucky that Northwell has the Bergs or the business-related groups that do speak to a lot of that. And some of the things that we do at Staten Island, we are homegrown, and some of the things we do, we get to leverage these initiatives that are done through the Bergs and through the Center for Equity of Care, through the Northwell Central Office, because to go back to another thing, it's a journey, right? So we started thinking, we're going to do this, it's going to take this is going to be our roadmap, this will be our timeline, but then to say, actually, it's a longer timeline, and it has different weaves and branches, and it's going to bring us in different directions. And I think that's the beauty of these things, right? It starts small, it grows. What are we going to do next? And understanding that it is a journey. In my opinion, we're not where we want to be. We know we want to do more, but having these programs that then let us see the future vision, yes, it almost makes us more engaged, more excited to grow and bring and deliver to our patients, to our team members, to our community, all of these things that will impact their lives, right? Because healthcare is about your health, but then it's also about all the other things in the community around us, and we are a big part of the community here on Staten Island. And I guess the other thing I would say that in the teaser bucket, as part of some of the work I do through SIUH and for the Diversity and Inclusion Committee, is working with our Katz Institute for Women's Health. And there are a lot of women's health initiatives that do not just speak to the typical aspects of women's health related to OBGYN health, breast health, et cetera. We think about women's heart health. We think about what are the endocrinologic issues that women deal with differently than men. What are the types of cancers that women deal with different than men? And building programs around women in a sort of women-centric model is started. It has definitely started, and it will be coming in different avenues, in different platforms to the organization as well to support it. And just because you're a patient who's engaging with the program that you're in, that doesn't mean they can't engage with the programs that I'm speaking about also, because it really all does go hand in hand, yes, and come together.
That's amazing.
And one thing I also want to touch upon, and you mentioned with our partners in the community, that we do have and historically have done some work with the Pride Center on Staten Island. I think not to fall back on this, it happens so often, COVID put a wrench in some of the things we had historically worked on, and I know our community health partners have re-engaged with that group to partner on some initiatives and hopefully get more things going together so that we can bring the work of the two groups to the forefront for our community.
Yes, which is actually important to our program as well. We do engage in community outreach events, and we do have affiliation with various agencies on Staten Island, and we always say yes. Whenever we know there is an event that will be in the community, I round up my team. I said, okay, it's time to go. We're going to provide some education. We're going to see if any individuals needs access to our care, our service, so on and so forth. So yeah, the Pride Center, extremely important to our agency, specifically to the program that I cover, and it's a strong foundation that we have with them.
Yeah, and then when they let us know what's going on, we try to amplify as their ally to our organization the types of events that our team members can partner with them on and participate in.
Definitely. I think I also want to say in terms of healthcare, health, it is not a privilege. It is a right? I think it's just important to remember that. And I think as a healthcare provider, you'll be the healthcare provider. And I think it's just really important to other healthcare providers as well. When you take on this role as a provider, it is not really about judging individuals as to if they are members of the LGBTQIA plus or not, if they're women, if they're men, it doesn't matter. You took this position because you care. And I think it's just really important that as many providers join this initiative and say, you know what, maybe I do not know as much that I think I should when it comes to what these individuals in the community, what they face. You know what, let me participate in the educational sessions. Let me engage with other providers that maybe are more versed when it comes to providing care to the LGBTQIA plus community members, and just to engage and elevate your mind and know more about what's going on and how you can impact their lives and help. It is a right for everyone.
You know what I think also happens when we do these initiatives is it makes people stop and pause for a minute. They went into healthcare, like we said, to care and for the right reasons, and people get busy in their routines, they're seeing their patients, and I don't think they always stop to say, something either isn't right in this interaction, or am I missing something important about this patient? And as we push out these educations and these programs, I think people are reminded to stop and pause and think again about their patients as this individual, as these aspects about the patient. And you do a training, you go back to your office to see a patient, and perhaps I was just in this education. Should I be asking this question? Should I be approaching this problem a different way? And I think it just brings it back to the forefront of the provider's mind. And there's so much value in that. And just continuing on all areas of the need for personalized care. And this is just one of the areas where it's just so super important, because things are so individualized and important to the patient. And if you don't draw that out from them, you're not going to have that best interaction, and they're not going to get that holistic view that they need that you spoke to earlier.
Yes, I agree.
So Bisi, let me ask you, if we have our community who gets to see this conversation that we're having, how would they access care at your program currently?
So if we do have individuals in the community in need of our services, they can come directly to our location, 242 Mason Avenue, Staten Island, New York. And our number is 718-226-2640 or 2642. We always have individuals ready to pick up the call and to schedule appointments. Again, we do provide preventive services, PrEP and PEP, STI testing, HIV testing, overall HIV primary care services as well.
And I know as we continue to generate this list of LGBTQIA competent providers and our ally providers, as you described them earlier, we'll try to get those lists out to our community partners so they can share it with the members of their organizations.
Yes, and we also plan on distributing the list on the intranet, the SIUH internal website, and also on the internet, the global internet, for anyone to be able to access and identify a provider that they would like to schedule an appointment with. Of course, anyone can be contacted in terms of scheduling life-sustaining medical checkup. However, at least these individuals, they have identified themselves as being allies. So hopefully that will just engage the individual to schedule that appointment and take the first step and actually see that provider.
It's wonderful.
Yes, great, thank you.
So we really want to thank the Alice Austen House for hosting us here today. Alice Austen House is a historical landmark here on Staten Island. The work that they do is aligned with this conversation and the work that we're doing over at Staten Island University Hospital. When we're in Pride Month and we're reminded of these important topics all throughout the year on Coming Out Day and Transgender Remembrance Day, we have to use those opportunities to elevate this need for our community, bring the resources, and just try to deliver that holistic care that Bisi spoke of, and remember the needs of each of our patients, team members, and staff as individuals as they're on their own healthcare journeys. And I want to thank you again, Bisi, for coming with me here today and having this conversation. The information that you provided, the work that you're doing, it will go so far and impact so many lives of the people we care for.
And thank you for giving me the opportunity to come here at this fantastic institution, the Alice Austen House. It's beautiful here.
It's so beautiful.
Yeah, it is. So thank you so much. And we're here. We're here to help, and just reach out to us.
Be sure to check out our Pride Month bonus episode, featuring a mini tour of the Alice Austen House Museum with the museum's executive director, Victoria Monroe. HealthWish wishes to thank our very special guests, Dr. Nicole Berwald and Bisi Apanpa. as well as our gracious hosts at the historic Alice Austen House Museum in Rosebank. We're interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.